Good afternoon and happy St. Patrick's Day to everyone in the spring N301 2008 section. I want to take a moment to make some comments on your journals that I finally got read this morning. I had hoped to have them back to you earlier, but as fate would have it, I am usually pressed to the last minute, just like you are. We're all human and we're all running as fast as we can. Most of you did a really nice job of kind of synthesizing and putting into those that section one, those first 5 statements of what you believe was important and the key points you wanted to remember. Most of you also did a fairly good job of identifying a reasonable question that you would want to generate from your reading of those materials. I was a little concerned, though, when you got to that third section about how you might use this information in practice piece, or what you would take forward, or a new idea that came to your mind. Most of you in that section focused your ideas around the idea of the individual patient. I'd just like to reflect back with you that this course is about population-based health. If you remember from our syllabus in our week 3, we had some readings on what is population health. At that point, we had some good readings about what is population health. I'm going to send this to you today sometime. This is the intervention wheel that we use in our community-based public health course in our accelerated bachelor's program. At the very center of this wheel are interventions that are based for the individual. Kind of the middle circle of this wheel are community-based interventions. And out here, this broad circle are those interventions that are based for the population. So when you're in your practice in your coronary care unit, or you're in your diabetes clinic, and you see that individual with diabetes, or you see that individual with a cardiac risk or a coronary event, look at that individual and not think about that individual, but think about the thousands and sometimes millions of individuals in this country who have diabetes or are at risk for coronary artery disease. That's what this course is really focused on. We're asking you to think about those in terms of populations and the impact that those have on the care that people receive in this country. So again, I was a little bit surprised because many of you, I thought, had understood that concept early on based on my readings of your journals and some feedback that I had provided. So I'd ask you, if you're feeling a little fuzzy about that area, to go back and reflect or reread some of that content from our week 3, and then look back at some of the readings that you had this past week, or 2 weeks ago actually, to think more about the population and not the individual. Moving forward this week, we've got some readings on determinants of health and social and physical environments and access to quality and access to health care. I think you'll find those materials of interest. We're at week 9. Our semester is going to be wrapping up before you know it. I think most of you are still on track and are doing a really good job. I do appreciate those of you who have forwarded me your health policy alerts. You know that everyone is required to post at least one. You don't have to respond to any of the health policy alerts, but you have to post one, and those will be due by April the 15th. As always, if you have comments or concerns, please don't hesitate to call me or email me. I will be in touch as soon as possible. I will get your journals back tonight. And again, I hope the week going forward is good for all of you, and I'll be in touch. Thanks again. Take care.